Ultrasound. This is an ultrasound study of female pelvis and other organs. Age 23 years. She gives verbal history of giving birth to a female baby 1 month back, and now has developed a lump. Is fluctuating lump in the region of right lower abdominal quadrant, and it is hot. So we will start our scan from the uterus and we'll proceed accordingly to find what this mass, fluctuating mass is. This is the urinary bladder. This is the urinary bladder in transfer section, and now I am going into rotate the probe 90 degree to get the longitudinal section. Here I am now. This is the vagina, this is the cervix, this is the uterus, this is the fundus of the uterus, this is the anterior segment, this is the posterior segment, this is the urinary bladder in longitudinal section, and you see that this is a typical postpartum appearance of the myometrium. The myometrium is globally, diffusely showing decreased parenchymal echogenicity with tiny, very tiny, small echogenicities in it. So this is a 1 month postpartum uterus in longitudinal section, and the endometrial canal. This is the endometrial canal, which is clear of any RPOCs or any retained product of concept, any other pathology. It's clear, central. See, this is the endometrial canal, and it is central. So there is no myometrial mass. Cervix is clear. However, now when I rotate the probe towards the left side of the patient, I come across a globular area, this one, a globular area which is filled with medium level internal echoes, and it gives posterior acoustic enhancement. Strong back wall is seen posterior to it, and it is separate from the uterus. This is the uterine outline. This is the posterior wall of the uterus, and it is separate from the uterus. So this is a cystic area which is adjacent to in the right adnexa. Now, this is small amount of fluid with echoes posterior to the uterus. This area from here to here. This is fluid with internal echoes. And it becomes continuous. This area becomes continuous with the cystic area that we were seeing, and it is separate from the posterior wall of the uterus. This is the posterior wall of the uterus. It does not relate to the uterus, so small amount of fluid is also seen posterior to the uterus in the pelvic cavity. In transfer section, this is the uterus, postpartum uterus, typical appearance of a postpartum uterus, magnified view with central clear endometrial canal, measuring 6.3 centimeters, normal for postpartum. This is the endometrial canal, the encircled area. This is the endometrial canal, and there is nothing significant. In transverse section. However, in longitudinal section, I should have taken the length of the uterus. The uterus measures 10.6 centimeters in length and 4.6 centimeters in anterior-posterior diameter. This is normal size. However, the myometrium does show typical postpartum appearance. Now, relationing of this cystic mass. This was a small amount of fluid seen posterior to the uterus becoming continuous with this cystic area. Now this is the cystic area in total. It measures approximately 5.4 into 5.3 centimeters, and note the equals with